So Julie is the epitome of what a nurse is and should strive to be. I've worked with Julie for a few years now, and every day she eludes the Caritas process. It really has been difficult narrowing down one story to demonstrate this. One of the most recent stories at the time had to do with a patient who felt that they were at the end of their ability to deal with their pain they were experiencing. This particular patient had been to the ER multiple times for no pain due to not having a primary caregiver and sent home every time. He was placed on Julie's schedule for evaluation of his shoulder pain. At this appointment, the patient was visibly in pain and verbally stating that he wanted to harm himself. He hurt so bad. Julie took this also seriously and started to establish a plan with the patient to get him taken care of. She got on the phone with social services, general medicine, got the patient in for an aspiration of the shoulder to determine infection, and the whole time keeping calm, reassuring the patient that he will be taken care of. I was there the entire time watching Julie handle this situation with poise, grace, and compassion. Ultimately, the patient was admitted, infection treated, and pain subsided. I think if Julie would have quote-unquote overlooked this patient, as some had done before due to his past, the outcome would have been a whole lot different. I marvel every day on how Julie interacts and treats not only her patients, but also all of us around her. I feel she checks all 10 of the Caritas boxes. She is a joy to work with, and we as RNs can only aspire to be as good as her. She totally deserves this honor.
From the first day I started working with her, it was clear her impact on patients as a whole, as well as the department. In every single patient encounter, Julie exemplifies a caring and healing approach. She not only identifies what the patient is in for our orthopedic department, but also understands them as a whole. She finds a plan for the patient that works best for their family, financial situation, and well-being. Even though I'm not in the room during her visits, the amount of baked goods, phone calls, and positive reviews that Julie gets monthly from patients is very noticeable. Many times, I'm seeing a patient for their first time that has previously seen Julie. They, of course, ask how she's doing, where she's at, and tell me all about their encounters with her. We've had some serious times in our clinic in terms of mental health. Julie has identified patients going through hardships in which multiple other providers did not seek out. She steps outside of her orthopedic specialty and goes right into the nursing role that she has. She nurtures them to the core and does all she can to provide them what they need in that moment. Outside of patient care, Julie is a glue to the department as well. She is one of many people go to for advice, education, and to just talk to. I know every single provider would say that about Julie, that they like working with her and that she's an asset to our department. She has given her life and soul to nursing, and as well as a clinical nurse specialist. She truly embodies the compassion, wisdom, love, and caring it takes to be in the nursing field. I'll forever be grateful to have her as someone to learn from and as a coworker, but as a mentor in altruism as a healthcare provider.
You know, I would never want this for myself. There's too many people that live this daily. I work with them. All the nurses I work with, every staff I have does the same thing. So I really feel I don't do anything special, but I love what I do. I'm fortunate to be able to do it. And now I'm gonna cry. I'll try not to cry. I do this a lot. But I'm really privileged to care for patients. It's an honor that they trust me, and I don't take that lightly. So anyway, let's eat burgers and have root beer. Thank you, Heather, Leah, everybody who did that. I love working with you guys, so thank you.